Yes, it looks like we are live. So, thank you everyone for joining us today. I am Megan Phillips of the Train with Trust Project, here with Jody Ambrose of the Train with Trust Project. And we are again with Dr. Sue Dyson, who has been so generous in working with us ever since the release of the movie, The 24 Behaviors of the Ridden Horse in Pain, Shifting the Paradigm of How We See Lameness. That movie was produced by Podma Video in partnership with the Train with Trust Project. And helping that film make a greater impact, we're continuing to do these Facebook Live events so that we can talk more in depth about horse behavior and how we can assure their health and well-being, something that Dr. Dyson is an expert in. So in keeping with the concept of shifting the paradigm, we're talking today about looking at something that some people take for granted, tacking up and mounting. Dr. Sue Dyson and her colleagues have studied the behavior of horses during tacking up and mounting and have found some really interesting information is in that time period that we're engaging with the horses before actually riding. Pardon me. So that's what we'll be talking about today. The Train with Trust Project is a 501c3 nonprofit organization. If you haven't checked out any of our other conversations and you're interested to know more, please check that out. You can see more of these conversations and link to all of them on our website, 24horsebehaviors.org. And you can also, if you like the work that we're doing, if you'd like to help us continue, you can also give us a donation. So with that, I'm going to be in the background. I'll be taking any questions you folks may have. And Jody, I'll let you sort of take it from here.
Okay. So I'll just give just a real quick bit of my background. I'm a dressage trainer initially, and so in my career, my focus was always on the riding part of working with horses. But I think inevitably any of us who ride enough end up with horses that have undesirable behavior in the process that it takes to get up on their backs. And we end up either learning to address that behavior or we learn to ignore it. And so my second career has been as a behavior consultant. And so I have ended up doing a lot of training and retraining horses to have better behavior in the cross ties or ground tied or in the stall getting ready. And then at the mounting block, I've put in a lot of hours with horses, just taking my time to get on, and some days not even being able to ride because I had to address behavior that was prior to being ridden. So I think most of us can identify with some of the behaviors that we're going to talk about, but I'm curious, Dr. Dyson, how did you make your decision to actually study the behavior that happens before the rider gets on?
Well, there were several reasons. As most people are aware, I am passionate about seeing horses ridden as part of the clinical investigation of any problems that horses are experiencing during ridden work. And therefore, I have taken upon it myself to observe those horses during tacking up and mounting and making a number of observations and chatting to riders and realizing that they had often been unaware that of the behaviors that their horses were showing. And then there were a couple of horses that were presented for investigation because they had behaved dangerously towards the person doing the tacking up. One horse had bitten the rider severely on several occasions and therefore was presented for investigation. And another horse had kicked a rider with a resultant fracture. And therefore, I felt that we needed to determine whether or not there were any relationships between abnormal behaviors during tacking up and any other concurrent problems. And then there was also the issue of gastric ulceration, and gastric ulceration has often been blamed as the cause of abnormal behavior during tacking up, particularly abnormal behavior during tightening the girth. And this has been called girth aversion behavior. But there had only been one very small study from UC Davis in the United States, which had looked at a small number of horses, and only about 50% of them had actually had gastric ulceration. They had improved in their behavior during tacking up after resolution of the gastric ulcers, but the remainder, there was no real true explanation for what the underlying cause of the girth aversion behavior was. So we set out to investigate. So we performed a prospective study. So we recruited 193 horse rider combinations from all over England. And these included horses ridden by students at equine studies colleges up to elite level competition horses. So a big spectrum of horses and riders. And prior to starting the study, we compiled an extensive questionnaire which was based on the observations of a group of us during tacking up and mounting. So, for example, the questionnaire included, when you go into the stable or the stall, approaching the horse with the tack, does the horse come to you, or does it turn its backside on you and go to the back of the stall? When you go to put the bridle on, does the horse keep its head still, or does it raise its head excessively high? And there were yes/no answers to all these questions. So we recruited these 193 people, and this was a collaborative study which involved me asking the rider questions while I observed the horse, either loose in the stable or tied up in cross ties, or tied up within the stable or outside the stable, or just as the owner would normally have it before they tacked up. So the horse was observed with no intervention whatsoever, whilst I first of all asked the rider, does the horse show any abnormal behavior during tacking up? Yes or no? If they said yes, I asked them to describe what behaviors they had observed. And the same applied to mounting. Did the horse behave normally during mounting? Yes or no? And if no, what behaviors had been observed? We then went through this very detailed questionnaire, asking about putting the bridle on, tightening the noseband, putting the saddle on, tightening the girth, and then questions relating to mounting. So did the horse approach the mounting block if it was mounted from a mounting block, or did it try to reverse away from the mounting block? Did it stand still, or did it try to move all the time? When the rider first got on the horse, did it rush off, or did it wait to be asked to move forward? And when it did move forward, did it move forward normally, or did it dip its back? And so there were lots of yes/no answers. So we had this tick sheet that was filled. And during the observation period, the horses were also video recorded. So we had a record of how they were behaving at rest. And then the rider was asked to tack up as they would normally do so, whether they put the bridle on first or the saddle on first, and to do everything normally. And then, using that same questionnaire, I would observe what the horse did. So, for example, did the horse raise its head when the reins were being put over the horse's head? Yes or no? Did it put its ears back? Did it swish its tail? And it was quite interesting to note that some of the more astute riders would make comments such as, oh, The horse does put its ears back when I tighten the girth. I hadn't noticed that before. Or the horse is fidgeting, it's moving about. I hadn't noticed that before. They had been made aware that the horse might do this from having answered the questionnaire questions. So once the horses were tacked up, we then assessed the fit of the saddle to the horse, noting particularly whether or not there was adequate clearance of the pommel at the withers from the spine, whether or not the tree points were too tight, whether or not the saddle was of an appropriate length, whether the saddle tipped forwards or backwards, whether it bridged. And then later, a different assessor evaluated the fit of the saddle to the rider and established whether the rider was positioned in the middle of the saddle or on the back third of the saddle. Once the horses had been tacked up, they were evaluated moving in hand at walk and trot to establish whether or not they showed any lameness in hand, and that was done by myself. And then the horses were mounted and the same tick box questionnaire questions were answered by my observations. The horses then went off to an arena where they were assessed moving by another clinician who was not aware of my observations, and she determined whether the horse showed any evidence of lameness when ridden. And another assessor, who was a qualified coach, assessed whether or not the rider was in balance and whether or not they sat in the middle of the saddle or the back one third of the saddle. And then we had to perform fairly advanced statistical analysis to determine whether or not there was any relationship between the number of abnormal behaviors that were shown during tacking up and or during mounting, and whether or not those number of behaviors was related to abnormal saddle fit for the horse, abnormal saddle fit for the rider, the presence of lameness in hand, or the presence of lameness when ridden. And what we showed, both for tacking up and for mounting, was that there was a positive relationship between the number of abnormal behaviors shown and the presence of lameness or the presence of tight tree points of the saddle, or the rider's weight being concentrated through the back one third of the saddle. So the more behaviors the horse showed, the more likely it was to be anticipating pain either from the saddle or from exercise and when it was lame. So perhaps we could look at some of the slides so we can look at what normal is, and then we can look at what abnormal behaviors were. Megan.
Here comes.
So here we have a little horse which has not got the ideal conformation. It's got a rather dipped back, what we call a lordotic back. But this pony or little horse is just standing with completely still unless the rider asks the pony or little horse to move over. It's got its ears pricked and alert. Its eyes are wide open and engaged. The pony is standing quite still. It's not swishing its tail. It's not lifting any of its limbs. And it looks happy all the time during all aspects of the tacking up procedure. And this is what normal should look like. And let's move to the next picture. And this is a horse pictured on the left after the end of tacking up, but pictured on the right during application of the saddle and tightening the girth. And you can see that the ears are back. The horse has an intense stare in its eyes. The nostrils are contracted. and the horse is got its mouth wide open and it's biting aggressively. And this is very abnormal behavior. It was interesting when we looked at the analysis of what owners had observed and what they had not observed. They were quite likely to have observed aggressive behaviors, such as biting or kicking or turning the head towards the girth, whereas they generally did not observe the position of the ears, tail swishing, the expression in the eye, the contraction of the nostrils. So those more subtle signs tended to be overlooked. So let's move to the next picture. So these are two different horses. The horse on the left is having the bridle has been put on behind, and we can see that the rider is adjusting the noseband. The mouth is being opened repeatedly, and the horse was also rubbing its nose continuously against the bars of the stall. These are not normal behaviors. Likewise, in the horse on the right, the saddle has just been placed on the horse's back. Prior to that, the horse's ears were forward and it had an engaged expression in its eye, and its head was in a more or less vertical position. Now the saddle is being placed on the back, the ears have gone back, the horse has an intense stare in its eye, and it's tossing its head up and down. These are not normal behaviors. Let's look at the next slide. So these are pictures of all of the same horse. Prior to the bridle being placed, the reins have been placed over the horse's head, as has the neck strap of a martingale. The horse is then yawning, which is not normal under these circumstances. Then as the rider comes to raise the bridle to put the bridle over the horse's head, the right ear has gone back. This is quite common and is not abnormal. Quite commonly, when the bridle is placed on the horse behind the ears, the headpiece behind the ears, the horse will open its mouth a couple of times, it will place its ears back, it may blink repeatedly. We do not regard those as abnormal behaviors. But when we see on the far right, the horse is doing more than that. Yes, it's closed its eyes. Yes, the ears are back, and I wouldn't worry about that at all. But the horse is throwing its head up, and it's trying to avoid the headpiece being placed behind the ears. That is not normal behavior. And gaping with the mouth wide open like that is also not normal behavior. Let's see the next picture. And this is still the same horse. So on the far left, the head is still up, the mouth is open, the tongue is partially out, and now we can see the white of the horse's eye. And then in the middle picture, during tightening of the noseband, the ears continue to be back. And in the picture on the right, the mouth remains partially open, the ears are back, and the horse has an intense stare. And these, again, are not normal behaviors. Let's look at the next slide. This is two different horses showing more aggressive types of behavior. Tail swishing. The horse on the left was picking up the right hind limb repeatedly and kicking forwards underneath the horse's belly, whereas on the horse on the right, which has not yet had the girth placed, it's just had the saddle placed on the back, the horse is swishing its tail vigorously and is about to kick backwards with the right hind limb. Again, not normal behaviors. And let's go to the next slide. The horse on the left is turning towards the girth and it's attempting to bite either the handler or its side as the girth is being tightened. This is not normal behavior. The horse on the right is turning towards the handler on the right who was holding the horse. It's swishing its tail as the girth is being tightened. Again, not normal behaviors. And the next slide. This horse on the left, the saddle has been placed on the horse's back. Nothing has happened with the girth yet. The ears are back. We can see the horse has an intense stare. We can see the white of the eye. And we can see that the left hind limb has been picked up and being brought forward underneath the belly. And then on the picture on the right, the rider is now tightening the girth and the horse is turning its head towards the girth and attempting to bite. Again, not normal behaviors. And the next slide. So those are just highlighting what's going on. And these are horses that are showing abnormal behavior during mounting. So the horse on the left is reluctant to approach properly the mounting block and stand by the mounting block. It constantly tried to move away. Now, obviously, this could be a manifestation of inappropriate training, but also it could be in anticipation of pain. And then the horse on the right is not standing still. The horse is immediately trying to walk forwards as soon as the rider is placing one foot in the stirrup. So these again are not normal behaviors. But bear in mind that the behavior of mounting may be a reflection of inadequate training, and they may be resolved if there is no underlying musculoskeletal pain, either induced by the saddle or because the horse is lame. It may be addressed by appropriate training. And finally, we can see this horse. What I want you to look is the posture of the horse's back. The horse has dipped its back as the rider has asked the horse to move forwards. So the head has gone up and the horse is dipping its back, which is again not normal behavior. This is one of the manifestations of so-called cold-backed behavior. So I think that kind of gives an overview of what we did. And one of the interesting things that I find is that most of you are probably aware that we've looked at abnormal behavior during ridden exercise. And if we take away the pain by the use of nerve blocks, then many of the behaviors disappear almost instantaneously, or they may reduce dramatically in their frequency of occurrence. If we have a horse which is a lame horse, which is showing abnormal behaviors during tacking up and or mounting, even when we have transiently removed their pain through nerve blocks, they behave exactly the same during tacking up and mounting. If we then treat the horse successfully for whatever its underlying problem was, then we will see gradual improvement in the horse's behavior during tacking up and mounting. And that may take several weeks until the horse becomes normal. And it's always interested me when I have done follow-up examinations on many horses, when, for example, they've come back for a re-examination 8 weeks after perhaps they had a surgical intervention and they've been going through a rehabilitation program, that owners will come back and spontaneously say, my horse's demeanor has improved fantastically since the surgery. I hadn't noticed there was anything wrong before surgery, but now I recognize that my horse appears much happier and is much more compliant for grooming, tacking up, etc. So the owners don't notice there's anything abnormal ahead of time, but they are aware of improvements in the horse's demeanor and general attitude when that improves, which is fascinating to me. So it goes to show that I think that either riders don't notice the behaviors, or they've become so used to these behaviors they think they're normal for horses, or they don't understand the potential significance of the behaviors. And I think that in everything that we do with horses, it's good if we can observe the horse and recognize these behaviors which may be a reflection that something is not right. None of the behaviors are specific. One horse with hind limb lameness may be very fussy with the bridle being put on. And I was quite surprised by the prevalence or frequency of abnormal behaviors during bridle placement. It was more than I had anticipated. I had expected most of the abnormal behaviors to be more obvious during saddling, but in fact, there were a lot of behaviors we observed during placement of the bridle. And there were a lot of what we would call stereotypic like behaviors, like repeated head tossing or repeated rubbing the nose against the side of the stable, or if they were tied up in cross ties, constantly shaking their heads from side to side, or stepping backwards repeatedly, things that people didn't consider as being at all abnormal, but which are abnormal.
Yeah, that makes me think of something you've brought up in the past, I think in multiple conversations that we've had, about the fact that so often we learn to ride on lesson horses or school horses that are in the job that they're in, maybe because they're semi-retired or not completely sound. And so it really makes sense that it's normalized for a lot of us, because the horses we grow up riding and being around probably are more likely than average to exhibit these kinds of behaviors based on this research.
Yes, that's certainly true. If you looked at some of the horses at the equine colleges, some of them were privately owned, but some of them were college-owned horses. And I well remember the colleague who was doing the video recording of the horses during the preliminary examination and during the tacking up. And she commented to me at one of these colleges, why are these horses so withdrawn, Sue? They're all just standing there looking disengaged. They're not reacting to the presence of people. Why is that? And I think it is because the horses have become disengaged because they've got chronic discomfort. And therefore, I wouldn't go as far as to say necessarily learned helplessness, but they're certainly withdrawn. And to me, that is not normal. And I've observed the same thing when horses have been brought to the clinic for investigation, that I would expect a horse which is in a new environment to be paying attention to what's going on about it, and being in a strange stable to be exploring the stable. But if I come into the stable and the horse is just standing there in a non-reactive way, that is not normal.
Yeah, and that brings up, you talked about how people tend to miss the subtle signs and will sometimes pick up on the more dangerous or aggressive behaviors. And you talked about the number of behaviors that horses exhibit being significant, but I'm wondering about the significance of the intensity of the behaviors, because based on what you just said, and I think my experience would back this up as well, that sometimes less behavior is a sign of more discomfort. Some of the horses I have that are sort of the most well mentally and physically are expressive horses that sort of get their feelings out. And so I guess my take on that would be it's really important to know your horse, know what's normal for your horse when your horse is feeling good. Certainly, we've all had that mare that pins her ears when she doesn't really, mean she's angry. And there's other horses that if they pin their ears, it's super significant. So it seems to me like like you said, observation is really critical. I think video is a super valuable tool for things like this, because when you're getting a horse ready and getting on your back and forth, you may be doing other things, looking in other directions. Having that video to look back on, you can, look at later and see what's really going on, and you might see changes, because really it sounds like that's probably the biggest indicator that something's wrong, is when things were one way and then they become a different way.
Absolutely, absolutely. But I also think you need to pay attention if you're thinking about buying a horse and you go to try the horse, because it brings to mind a dressage horse that I went to look at for a client, and it was in the cross ties to be tacked up, and it shot backwards, it kicked out, it did all sorts of strange behaviors that were potentially violent behaviors. And the groom just joked about it. She said, "Oh, this horse always does that." But that's not normal. And that should highlight to you that something is not right. Yeah. And it shouldn't just be played off as that's normal for that horse, because this is not normal behavior. And it is an indicator that the horse is not right. And in fact, during ridden exercise, this horse really struggled in the tempi changes and in the canter pirouettes. It really, really struggled behind. So I would be confident in saying that this horse did have underlying musculoskeletal discomfort, and those behaviors during tacking up were a manifestation of anticipation of pain during the ridden exercise. So even in a pre-purchase examination situation, as a potential purchaser, watch the horse like a hawk in all its behaviors, and don't just accept that the horse is going to be presented to you as a tacked up horse. You want to see that horse being tacked up, because you want every piece of information you can possibly get. The saying, buyer beware, I think is very true, and you as a purchaser need to be a detective in trying to pick up every piece of information that may be useful to you to tell you whether or not this horse is a reasonable risk for you for purchase or otherwise.
Yeah, that's absolutely true. I'm working with a horse right now that was purchased just a few months ago, and an extensive pre-purchase exam was done, and nothing significant, particularly significant, was found. But the horse was extremely fidgety in the cross ties, and had what I would describe as pretty severe anxiety about the mounting block. And I didn't meet this horse until a few months after he was purchased, but those were the first two things I noticed, because that was what I saw when I arrived. And I was actually brought in because the horse had started bolting and bucking, which was, had never happened before, until we did a little more digging and found out that it had happened before. But what I saw was that when I looked at the videos from when she bought him, she had taken a lot of video when she'd gone to try him, and I just applied the 24 behaviors ethogram, and immediately was able to see somewhere between 8 and 11 behaviors just on the short video clips. So again, these tools to observe behavior may not give you a definitive diagnosis or give you a concrete reason to, not buy a horse, but it certainly gives you a lot of information in terms of what to look closer at, or sometimes what to maybe walk away from if you're not sure. I think that's really cool.
And I think that even if your trainer says, I think this horse is the ideal horse for you, don't ignore these signs. These signs are red flags.
Yes.
And that I would have to say trainers are often going to be on a commission basis as well. They've got a financial investment in wanting to expedite the sale of that horse to you, and you need to bear that in mind. So yes, it's always valuable to have an expert advising you, but still be your own observer, and don't become overwhelmed by what other people say.
Yeah. On the flip side of that, this was a horse that she was told she didn't take a trainer to look at the horse, and she was told that other people had liked the horse and their trainers had said no. And there didn't seem to be a real concrete reason why these trainers were walking away from this really nice horse. And, you know, in retrospect, they probably were better informed about some of these things that were more subtle. And, you know, maybe they couldn't even necessarily put words to what their sense was about this horse, but they saw something. It wasn't lameness, because the vets were fine with how he looked. It was there was some sense that this horse was either unhappy or disengaged or something like that. So yeah, I think, like you said, that it's important to look for changes, but if it's a horse you're just meeting, it's even more critical to really not excuse or ignore some of these behaviors that are happening before you get on.
I think it's also worth bearing in mind that although in the UK, ridden exercise is a routine part of the veterinary pre-purchase examination, in many other countries, including the USA, it is not.
No.
So just because the horse appears sound in hand and on the lunge, it doesn't necessarily mean it's going to be sound when ridden. And therefore, what you observe when you go to try the horse, if you're in a country when ridden exercise is not part of the pre-purchase examination, it is crucial that you pay attention to those signs.
Yeah, and particularly, you know, we talked a lot about saddle fit and tack fit in general, and sometimes that's something that happens after a pre-purchase, is that the tack is swapped out and changed. So it's important to make sure that you know, if you're going to buy a horse, you either, you know, it comes with tack that fits it, or you make sure that tack fits before you move forward with riding, because that can those behaviors can start up as soon as you get the horse home, if you're not really careful about making sure that the new tack that you're using fits.
Fits not just the horse, but also the rider, because you have to remember that in this study, from the statistical point of view, the risk factors for demonstrating the high number of behaviors were 1, lameness, 2, an ill-fitting saddle, most particularly tight tree points, but 3 was the rider's weight distribution being through the caudal third of the saddle. So, and that reflects often the fit of the saddle to the rider.
Yeah, that's a good point, because that is something that I've seen happen, where the tack comes with the horse and it doesn't fit the new rider. And so there's a lot of confusion about why there would be saddle fit issues when the saddle has always fit before, and it's because the saddle doesn't fit the new rider. And I see that a lot. It's, once you see it, it's kind of hard to unsee how often that's the case. And I've had clients sort of push back on me too, of, you know, well, I know this doesn't fit, the saddle doesn't fit me, but it's more important that it fit the horse. And that's not really the case, is it?
No, I don't think so. And I think that this is a largely under-considered problem, which, if you want to maximize performance, you must pay attention to every detail. And this is not just a fine detail. This is a fundamental issue, I think, that the saddle should fit the rider to enable the rider to be as well in balance with the horse as possible. And that's really crucial.
The other thing that occurs to me is maybe perhaps a little bit more in our wheelhouse in terms of being trainers, and you're a trainer as well, so you understand this just as well. But you talked a little bit about how the nerve blocks will take care of some of this behavior right away, and others will disappear gradually after treatment. Is that an issue of the difference between a learned behavior versus a direct causation by physical discomfort?
Yes, I think there must be some effect of habituation of some of the behaviors during tacking up and mounting. And particularly with respect to mounting, the horse may need to be retrained. So it needs to be retrained as to how to, for example, stand by the mounting block and not move away from the mounting block. And that can be done relatively easily using positive reinforcement. So if the horse stands, you reward it with food. You may want to coordinate that with a sound using either a clicker or your voice, and then give the reward. Or you may need to, for example, use a schooling whip just to gently tap the horse is on the opposite side to persuade it to step sideways, and then reward it so that it's then standing. And then you need to repeat this several times over, so that the horse accepts that this is what we're wanting the horse to do, to stand by the mounting block. And that's step A. We haven't put the foot in the stirrup yet, but we need to go stepwise, break the whole enterprise down into, first of all, coming to the mounting block and standing by the mounting block, and being able to do that on a repeated basis, and then coming to the mounting block, standing by the mounting block, and standing while I place my foot in the stirrup, and then progress that to actually getting onto the horse and rewarding it if it stands still. But I don't think that's a particularly difficult procedure in terms of training.
And counterintuitively, I often work with horses like this by giving them more freedom and working on these behaviors in a more cooperative way, rather not just positive reinforcing behavior that I capture, but actually giving the horse a little bit more control in the situation. I'll get the horse ready loose in a stall as opposed to in the cross ties or tied, where they can move away. I get really significant information every time they move away from me. If I'm working on something like fly spray or touching their face, if they move away every time I ask, then I know they're uncomfortable, and I can approach with positive reinforcement or some other way to shape behavior that I know they're comfortable with, because they have the option not to participate if they're not. And a lot of times I find just giving horses that little bit of agency where they feel like they're not being made to do something, but actually participating in something as an equal, that a lot of their anxiety and resistance just disappears, because you're on the same team. You're not setting up the same kind of conflict that so often is going on, and not just going on, but is so often underneath the surface in a way that the human doesn't even recognize that there is conflict happening. You know, there's a reason for all of these behaviors, and so you know, if you have the time and the knowledge to look into the root cause of the behavior and change the emotional state that's leading up to that behavior, that's how you take care of some of this more intractable behavior that doesn't go away as quickly when you treat the pain.
Yeah, I would 100% endorse that. I think that the horse has to have kind of its own ownership of the situation, and it's got to feel confident in the situation and not feel that it's trapped by the situation. And by having them loose, I think you will often engender a more positive relationship. And the other thing I think we need to think about in terms of mounting is that many people don't realize what potential discomfort they are creating for the horse because of their lack of athleticism getting on the horse. And I do think that the rider's mobility, the rider's ability, for example, to be given a leg up, such that they're not in any way pulling on the saddle, but they are being pushed up and just putting their leg over, is potentially more comfortable for the horse than somebody scrambling on from the side, even with a mounting block, but pulling the back of the saddle and rotating the saddle on the horse's back which is not good for the horse.
Yeah.
So I think that if there is a difficult situation, the rider should also take some responsibility for trying to improve their own ability to mount in as horse-friendly manner as possible.
Mm-hmm. Yeah, there are different methods of getting on. You know, I know people that ride on the racetrack who never use a stirrup. They get on, and they get on like a cat. You know, they're just almost weightless, and not just the tiny little jockeys, but all of these people that ride these big horses are able to get on with almost no impression on the horse's back, and then you see some people, you know, riding recreationally that just don't even think twice about putting their full body weight straight down, or even worse, I think, just into one stirrup. I see people put their foot in the stirrup and then hang there for what seems like forever before they throw the other leg over. And those are things that I think no one really explains to a lot of people about the effect that might have. If you layer these things, you have a saddle that doesn't fit, you have an orthopedic problem, you have a rider that might be heavier or not as agile, getting on slowly, and those things add up really quickly.
So I think that even just a little bit of thought about the height of the mounting block, you can make it so much easier for an unagile adult to get on if you use a high mounting block, and if you put steps up so that they can find it easy to get onto that high mounting block. That is potentially of so much benefit to the horse.
Yeah, and along the same lines, it's not cool or macho to get on from the ground.
No.
When I was growing up, I was really little and had a big horse, and so I got made fun of for not being able to get on from the ground. And so I went through a period of time where I, insisted on getting on, just to show that I would get on from the ground. And we all go through those things where, maybe our ego gets ahead of what's best for the horse. But as soon as I realized that that's not a good thing for the horse's back, I gladly used a mounting block, because that really is what's important, is the effect that we're having on the horse's back, and whether the horse is having negative effects from our choices.
Yeah.
So, one other thing I wanted to talk about is when these behaviors are not caused by pain. And I think that's probably more our wheelhouse than yours, but I don't think you can separate the two. I think it's important to understand the concept of what's called trigger stacking, and that if there are things going on that are stressing out your horse, they don't have to be big things, but if there are multiple things, they can add up to a big thing that can bring out some of these similar behaviors. And they might be pain oriented, or they might be anxiety oriented. Basically, they can be emotional or physical discomfort. And so I think when you see these signs, it can be a little tricky sometimes to peel apart what the causes are. Do you have any advice in terms of where to start? Like, obviously, we've talked about observing and identifying these behaviors. Would you start with nerve blocks? Would you start with something else?
Well, it depends on what the clinical picture told me. Let's assume that the saddle fit is appropriate for both the horse and the rider, and I can't see any lameness when the horse is ridden. I then need to be thinking, what else is stressing this horse? What could it be? What are the underlying problems? So I think it's a matter of going through a process of elimination. I'm going to be using nerve blocks certainly if I think that the horse is lame, and if the saddle doesn't fit the horse, then I'm going to be switching the saddle to see if the horse improves in its way of going when it's ridden. But I'm not going to anticipate that that's going to change its behavior during tacking up and mounting instantaneously, because it's not. So it is very much a process of elimination, eliminating the fact that there is an underlying pain-related problem. And in some horses, there's going to be pain plus other factors. So misunderstanding riders' cues, for example. So the horse has become more difficult. So the rider has perhaps become a little bit more aggressive. Maybe they are afraid that the horse is going to run away with them. So they are more restrictive with their hands, and the horse is getting increasingly confused about what is wanted. So you've got a situation which is potentially escalating.
Yeah, I think frustration in the horse is definitely underrated as a cause for all sorts of problematic behavior. I have two questions, and I don't know, Megan may have more. One has to do with dismounting and untacking, and the differences in the behavior that one might see between the two. If a horse is better after being ridden and not showing these same behaviors that they showed in the beginning, what's the significance of that in your opinion?
I would say that most horses behave pretty much the same during untacking. They don't show the same behaviors that they show during tacking up. Many horses will yawn after being ridden. So when the bridle is removed, they will yawn. And some people say that this is a rebound effect from having being a reaction to the removal of stress of the ridden exercise.
Yeah.
And I've certainly seen this in a number of horses, and a number of people during the questionnaire, when they were asked, does your horse yawn during putting on the bridle? Does your horse yawn during putting on the saddle? They would say, no, but my horse does yawn whenever I take the bridle off at the end of exercise. And I found this a very interesting observation, because I was not aware of how frequently this does actually occur. But I don't think it necessarily reflects that there's an underlying pain-related problem. There may be, but there may not be. So I would say in general, most horses, be they clinically normal horses, pain-free horses, or horses with underlying pain or an ill-fitting saddle, are relatively well behaved during untacking. It's only during the tacking up that they show the abnormal behaviors.
Interesting. Very interesting.
So it is an anticipation of what's coming in front of them.
Right.
Although we don't think that horses don't plan. They don't have much of a prefrontal cortex, so they don't plan. They're not planning what they're going to do tomorrow. So it must be some spontaneous, habitual response that they're showing in anticipation of the pain. They're not thinking, I'm going to try and kick the person putting the tack on. They're not whilst it is aggressive behavior, it is not necessarily targeted at the person putting the tack on. They're just showing a behavior which is, in this instance, an aggressive type of behavior that reflects the anticipation of pain to come. So when you're taking off the tack, they know that's the end.
Right. I did come across a horse the other day who, and this has happened before, where they were fine to bridle, but then after being ridden, when the person went to take the bridle off, the horse wouldn't put their head down to have the bridle taken off. And so I had the person deconstruct unbuckle the bridle so that they could take the bit out sideways.
Yeah.
Because my theory was that when the bridle was coming off, the bit was coming down and clanking into the horse's teeth. And it did seem to fix it, but I think it could have been that, or it could have been a number of other things. Could have been ear related, could have been all kinds of things. But I think very often, if there is a problem with untacking, something like that where the process of untacking is uncomfortable for
Yeah.
one reason.
Yes, I mean, we haven't really addressed the potential for oral problems involving the mouth.
Yeah.
And also we haven't really addressed the horse being head shy. It doesn't like anything being done with the head, and therefore it's certainly not going to like the bridle being put on. And even you may have to deconstruct the bridle in order to put it on, or you may have to use a very simple bridle, just maybe a headpiece and a bit and nothing much else, in order that the horse becomes accustomed to that over a period of time.
Yeah. I had an interesting situation with that where I had a horse, it came to me as an FEI horse that was really difficult to get the double on, which wasn't that surprising. But I spoke with, there was a member of the US team who was riding a horse that was a full relative of my horse. And I spoke to her about what he was like. And he also was very difficult to bridle. And they were both very difficult to catch in the pasture as well. And so, genetically, apparently there was some element of, and it was probably just, they were both very clever and, knew how to get out of things. But yeah, so there's other elements that can go into it. And again, I think it comes back to knowing your horse, knowing what's normal for your horse, and working with what's in front of you, and not assuming that because something's worked with other horses that it'll work with every horse. We have one other question, which I will read to you because it's a little bit longer, or I will summarize. It's a little bit longer. So this woman has a young mare who is perfectly happy being tied while grooming. She said she seems to feel safe and naps frequently while tied. But twice it happened that she reprimanded the mare for, I think, biting the saddle that was on the fence. And she fought and pulled back and tightened the quick release knot so that it couldn't be pulled, and the halter broke. So it sounds like this happened 2 times, and she's unsure what made her escalate so quickly. She's normally a confident, relaxed mare during saddling, mounting, and on the trail. And she's engaged, not disengaged. So she doesn't think that this is an anxious horse. So she's asking, she says, I did probably put more energy in the ask than I should have, using a firm voice, saying no, stepping towards her head. And now she just loops the rope over the fence and no longer ties her. She doesn't say she's unable to tie her, but apparently the issue is ongoing since this occurred. So you want me to answer that from a behavior standpoint?
Yeah, why not?
So I think oftentimes when we react in the moment to things like this, especially if they're not something that's happening on a regular basis, we do underestimate the intensity of our correction. And some horses who are not used to being corrected a lot will be very sensitive to a stronger verbal or physical correction, not meaning physical abuse, but something being moved towards them or in their face. And so it may have definitely been enough to unsettle this horse to the point that they no longer felt safe, even if their baseline was not what most people would describe as anxious. I think this is an instance in which videoing what's going on would be helpful, because a lot of times the perspective that you have from where you're standing and doing these things, it doesn't show you everything that might be helpful to know about how the horse is behaving and what that means about how they're feeling. And then I think the way that she's handling it is right, to not tie the horse until you can go back and systematically sort of rebuild the trust that was withdrawn. If you think about it like a bank account, you had a certain amount of cash in the trust bank account, and you took too big a withdrawal and got overdrawn. And so the key is to build up your balance again by doing things that build trust, make the horse feel safe, make the horse feel that you're going to be predictable and not do anything that's going to upset them. And over time, you should be able to get back to that baseline and hopefully maybe even work a little bit more on a better baseline, because if this happened, it means that maybe the relaxation was not was only the bare minimum that you need to do what you were doing, and you didn't have any resilience built in case something else went wrong. Do you have anything to add to that?
No, I don't think so really, except to say that rather than break the head collar, perhaps having it tied up to baler twine, which is going to break first, might be a safer option. I've seen a number of horses which have had quite serious head injuries as a result of pulling back whilst tied up, when being tied up to a solid object which didn't break.
Yeah.
And I think that there are ways of improving the safety of tying horses up, which we need to pay attention to.
Yeah, I agree with that. And I think a lot of us learned quick release knots that we've never had to use and get surprised when we find out that they maybe quick and release are both misnomers for those knots, and some of the equipment that now exists. And I will say too, with baling twine, there are certain kinds of baling twine that will not break.
Yeah.
So that's not even as reliable advice as it used to be, because we used to have pretty fragile baling twine. Is really heavy plastic that won't give. So yeah, I like breakaway halters, and I like breakaway loops of something. It's always easier to catch a horse than it is to fix a horse that's pulled back. Megan, do we have any other questions?
So I do see one other question on here, and it's not especially related to the topic, but I thought it would be worth addressing. The person is asking about what they might look into further if they have a horse that is reluctant, doesn't want to move forward under saddle. And so it immediately pops to my mind that this is one of those behaviors on the Ridden Horse checklist that we have available, and that Dr. Dyson, you're always very quick to point out that exhibiting one behavior on the list does not correlate definitively with underlying lameness issue. They point out that the saddle fitter has said that the saddle fits well, but that there are many other behaviors that using the Ridden Horse checklist with this horse would probably be a very good idea to do that first rule out, and then have a little bit more information to go with, because it could be a many number of things.
Yeah, but normally it does reflect an underlying problem. So I think it certainly merits further investigation.
Yeah. Okay, well, I'm going to put a couple of slides up on the screen here so that people can see, and we'll talk a little bit about our next live coming up in July, so just a few weeks away from that, and a couple of other things that we wanted to announce and let people know about. So our next discussion with Dr. Dyson will be talking about orthopedic exams and help finding a vet who can do the type of orthopedic examination that you're hoping for. And we've talked a lot about this during all of these lives, what an orthopedic exam or a full veterinary exam should look like. And then we also have available on our website, we do have a resource, a free resource available, which is the Selecting a Vet checklist, in addition to As we just mentioned, the Ridden Horse checklist, or the 24 behaviors checklist, the mobile field guide with the illustrations to show examples of what these behaviors look like, what to look for. But we also have this selecting a vet checklist, so you can find that free resource on the 24behaviors.org. You can also go to trainwithtrustproject.org. And while you're there, again, if you appreciate those free resources and you wanted to contribute to us, you can make a donation. Always never want to leave without bringing up Dr. Sue Dyson's book that she co-authored with Sue Palmer, Harmonious Horsemanship, Use of the Ridden Horse Ethogram to Optimize Potential, Partnership, and Performance. And you can order that in the UK, harmonioushorsemanship.co.uk, or you can also order it off of Amazon. So with that, I believe we are ready to wrap up.